I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, Raw and Unfiltered, bringing to you so many people from around the planet that are going to share with you their process of making the best decisions for themselves. And that's a critical thing that I find that we all need in today's world of medicine, health, or wellness, or biohacking, or whatever it is that you want to call it. And why is that? Well, there's so much information out there. It's really difficult to filter out the stuff that is relevant for you. And I'm being really nice about that because some stuff just doesn't work. But before you spend all this, crazy amount of money on what I call advanced technology, or I'm confused technology, because you're spending all this money on stuff that doesn't work at all because simply you did not need that technology. And so, how do we actually do this? I've been doing this for quite a while, and we do this actually through role playing. And so if this is your first time on this podcast, then it's all about role playing, where one person presents with a problem and the other will guide them to some form of resolution in about 6 minutes. And 6 minutes is not a lot of time, but you'll be surprised how much resolution we do get. But the purpose is not to get the full resolution. Well, of course it is if we can, but the reality is that what I want you to know is that you're not alone with this problem. Wherever you come from, whatever your profession is, whatever it is that you do, we all share so many of the same kinds of problems. And many of us don't have the right process to make the right decision. So that's what this is all about. Understanding that, number one, there is hope for you because you see yourself in the problem here today, and that there's a process out of this that might be a right for you, or perhaps you can have the trajectory towards finding out what will work best. So for today, what we're going to do is we're going to do the 6 minute role play. I'll do that after I introduce, or my guests introduce themselves. And then after the 6 minute role play, we'll unpack it. We'll kind of give you some other distinctions that are relevant to the particular problem that we played out, and also some action steps that you can take. And once again, this is just not, we're not here just to sell a product, or promote a person, but really to share with you the process by which you can make better decisions to optimize your health. So I want to welcome back Dr. Matt Ormond. Thank you so much for coming back. We had a great time last time. Two great shows with that, quite revealing in so many different aspects. And Dr. Ben Zuniga, thank you so much for joining us today again. So Matt, please, a brief introduction of yourself. We'll go with Dr. Ben. We'll do the role play. So let's get started.
You bet. Thank you, Dr. Bart. So my name is Dr. Matt Ormond. I am a chiropractor by training in Arizona, and I have a practice in Arizona and in Southern California. But I've been trained in kinesiology and acupuncture and really found myself in this space of holistic medicine. And so honored and privileged to have served some high-level athletes and some really, some visionary entrepreneurs. And this unique blend of chiropractic, kinesiology, acupuncture has given me the opportunity to just look outside the box, so to speak, and find unique solutions to an elite clientele, and ultimately getting them the satisfaction and the results they're looking for.
And this is one thing that's really excited about Dr. Ormond, because he's not within the box, he's outside of the box. And there's so many incredible solutions outside of that box that will absolutely serve you. And again, that's the purpose of this podcast, is to enlighten you with that possibility and opportunity to look outside of what you're used to or conventional medicine and find some remarkable solutions somewhere else. Dr. Ben.
Yes, thank you so much. My name is Benjamin Zuniga. I am an oral and maxillofacial surgeon out of Phoenix, Arizona. I've been in practice for just about 5 years now, and I think one of my favorite things about being a surgeon is helping people have a better experience than they have in the past with surgery. I feel that that's such an important part of not only going through the process of getting something that's needed, but also helping guide a patient through some of their anxiety, and then have a positive outcome on the other end is really important for healing as well. So I found that patient education is really one of the tools that I use to best equip my patients, to help them understand the process, to help them make decisions definitively so that they can feel good about that, and then to help them move past some of the fears that they've had from their past. That is what I really enjoy. I do general oral and maxillofacial surgery. I have some privileges at the hospital here, take care of patients who are dealing with infections all the time. And I also do some oral reconstructive surgery, implant-based surgeries out of one of the implant centers here in Phoenix. So it's a real honor to be here tonight. Thanks for having me.
Well, it's a great honor to hear another surgeon like yourself really up-level their ability to connect and have empathy with their patients, because certainly surgery is a very scary thing. I've been a surgeon for quite some time. It's over 30 years now. And the reality is that patients are super scared. And your demeanor, by the way, is just remarkable. And I can tell that your patients are very lucky to have you simply because of who you are. So
I
it's very
appreciate
impressive. You got a great friend there, Dr. Ormond. All right, let's go ahead with the role play. And once again, about the role playing, just so that the listeners understand, it's about delivering a problem that you might relate to. You might get triggered by it. This may or may not be a problem that's personal to Dr. Ben or not, but the whole point is that, you know, you get some guidance as to what is possible for you, that you find out that you're not alone, that it's okay to talk about it, and absolutely find somebody that can support you into some sort of resolution. So Ben, I understand you're going to present today, and then Dr. Matt will be your guide.
Thank you so much. So Dr. Ormond, I feel like I have some issues that may be very relatable. As a surgeon, as somebody who uses technology fairly frequently, I find myself in holding positions and having some upper back and neck pain that can be really difficult to alleviate. And I find that it also can sometimes affect the way that I move my arms. And you know, for me, it's really important to be able to have that flexibility and mobility with my patients. So I was hoping you'd be able to help me with some of this back and neck pain that I've been having.
Yeah, thank you for saying that. And indeed, I think that is a real challenge. If you could share, what is the primary concern? You mentioned possibly some decreased function in your arms. Can you tell me more about that?
Yeah, so I still have good mobility and everything in my arms, but I feel like I tend to tighten up the muscles in my back when I'm working on a patient, or sometimes when I'm looking at my phone or computer, and I can feel that tightness get worse throughout the day. And then at the end of the day, I'm just kind of sore in my upper back and in my arms. And I still feel like my neck, I just need to pop it sometimes. It just feels like it's really stiff at the end of the day.
Yeah, I call that, doctor, I call it the price of being awesome. So you are doing awesome things, and the body, it certainly takes a tax, right? There's a toll. And what's interesting, this is the framework. We look at these professional athletes, these elite athletes are prolonging their careers they have mastered the art of recovery. And so while it's pretty normal for a pitcher to be pulled in the 5th inning or 7th inning, and the next shot you see of that pitcher in the dugout, they have an ice bag strapped to his arm, or that they pull, you know, LeBron James out in the 4th quarter, Lakers are either winning or losing by far. He has ice around his knees. And so these athletes, they know the value of recovery, and they know the rigor of what they're doing. And I think there's some principles that we can borrow from that. What you're doing, there's physical rigor that is involved with your work. So when you feel that pain and discomfort show up, what do you do? What has worked for you in the past?
Well, if I'm able to, if I'm between patients, I will try to get some good stretches in. I even put a pull-up bar up in the doorway at my office so that I can hang from it sometimes. Sometimes I just need to get a good stretch in. And that does help to be able to get a good stretch. And I don't know a lot about pillows, or, you know, how they support the neck at night, or anything like that. I don't know a whole lot in that area, but I have tried to be very mindful about how I sleep as well, and support my head and neck, so that I usually wake up feeling pretty good. And it's kind of toward the end of the day that I start to feel that stiffness. I have started stretching a little bit more in my neck as well and arms. So those have been the most helpful things for me.
Job. That's wonderful. So you're already implementing some strategies that I think that are important. Now you mentioned sleep. Does pain follow you into sleep at all, or does it wake you up at night at all during a sleep?
No, thank goodness it hasn't been bothering me at night while I'm asleep. But I definitely don't want it to get to that point.
Sure, and it's super, super smart to stay in front of this thing because you have a long career in front of you, and no doubt that you can stay absolutely in front of this and even to a place of being pain-free. Do you mind if I ask you about hydration? How are you on a daily basis with water?
So historically, I have not been fantastic with hydration. I have made a bigger effort, and I have a water bottle that I keep in my office, and it keeps track of my water intake during
Smart.
the day. But as a surgeon, it can be sometimes difficult to take a break and to get water in. Sometimes I have longer cases and not a lot of time between patients, and so between checking records and running around from room to room or between long cases, sometimes I realize I get to the end of a workday and I haven't really uh, taken in as much water as I should.
Yeah, that. I think you're not uncommon there. I think that a lot of people in your profession have a similar condition or similar issues because it's you can't really pause a surgery either to go use the restroom. So there's some strategies we might talk about, and I want to commend you for stretching. And I think the pull-up bar is a really nice innovation that helps with that. Another thing is food wise. Are you eating? Do you get a breakfast most mornings? Are you getting food throughout the day of your workday?
I will usually get a breakfast in.
Mm-hmm.
Lunch is hit or miss on a normal day.
Yeah, that makes sense. And then another question, and thank you so much because this helps me frame to see what else might be there. On a level
Absolutely.
on a stress level of 1 to 10, 10 being extraordinary stress, 1 being no stress whatsoever. On an average work week, where would you put yourself on that stress scale?
I would say probably about a 7 or
Yeah.
so. It fluctuates a little bit, and I have gotten better at managing stressful situations and busy schedules. But yeah, I would say it's on about 7.
Yeah, very good, very good. So these are all, thank you for that. And these are all
Mhm.
pieces of the puzzle here, because initially what you're describing is structural in nature and really muscular in nature. And I can say with some certainty muscular because with a good night's sleep, it takes care of itself and it resolves and feels better in the morning. And what happens, of course, when you're sleeping is your body is restoring, it's resetting. When you're asleep, that diaphragm is working, so you're getting adequate air and blood supply. So with a proper rest cycle, those muscles are recovering. If it were more structural in nature, or neurological and even like a disc, you probably wouldn't have the same relief. In fact, many of those symptoms will show up during the nighttime. And
Okay,
so knowing that distinction becomes helpful to know, like, okay, we are working with soft tissue, so to speak. So stretching is going to be a primary recovery technique that you'll use. I think the implementation of heat and ice can be with some strategy. Heat, of course, will vasodilate, so you get blood flow into those muscles that are tight and having repetitive use. If you're finding more soreness, ice can be very, very useful because that
excellent.
the ice has a way it vasoconstricts, but in that constriction, it will pull away lymphatic tissue. Lymphatic movement can happen with the use of ice. And I find a strategy with ice and heat is 10 minutes on, taking it off for an hour. So you can really strategize of how to use those, implement those, the temperature. You mentioned pillow, and I'll circle back to pillow just a bit. But speaking of hydration, and I'm speaking to the choir because as a physician, the value of hydration. But a
Mm.
dehydrated muscle, the difference between a dehydrated muscle and a hydrated muscle is like beef jerky compared to filet mignon. So filet mignon is spongy and has some pliability to it, where a dehydrated muscle is just, it's stiff. And so hydration has some real properties here. Another, for instance, within hydration is just getting blood supply, blood flow through. The amount of volume of water that you drink, it equates to the amount of blood that's flowing through your veins. So water volume equals blood volume. And so with it being a closed system, when you have proper hydration, every beat of that heart permeates deeper into muscles and into organs. So you're just getting more oxygen delivery. So part of that soreness that you have and that residual stiffness will just be those muscles haven't had great oxygen supply.
Okay.
That's where, stretching, of course, helps that, because you're opening those areas up, which improves the vascularity. But what if we could improve vascularity from the stretching and movement perspective, that side of it, but also from the hydration side of it, and get those muscles to be more pliable and get better oxygen supply? So those are some strategies. And I'll speak into the water strategy, just knowing your circumstance, that you're in surgery and your day is scheduled really tightly. I think within the first 10 to 20 minutes of being awake, should be your first 20 ounces or so of water should be in, if not more. And then, by 10:30 in the morning, depending on when you start your day, you should have at least, the rule of thumb is half your body weight in ounces. So let's say you should be at least halfway to that goal by 10:30 in the morning or so.
Okay.
It is a well-hydrated body. And then from there, it trickles. You can, and I think for many, we'll try to taper water intake, past 3 p.m., you're tapering a bit. So you're just not up all night going to the restroom. So
you got a minute left, Dr.
Thank you. So that's a strategy that's there. And then another consideration, you mentioned, you're eating breakfast most days, lunch isn't happening, which is totally fine, but there's blood sugar considerations as well. If that body starts to dip into a low blood sugar, it's going to release more adrenaline, more cortisol. And so that puts your body into a fight or flight state. And the physiology of fight or flight is predictable. That muscles tend to tighten, and not tend to, muscles tighten in fight or flight. Blood vessels constrict. The diaphragm is a big muscle. It's a breathing muscle. And so when that diaphragm constricts, again, you're not getting great oxygen nor blood flow because of that. So blood sugar regulation becomes an important thing. So if I could give a take home in the next 25 seconds or so, I would continue with your stretching. One thing I would do on recovery side is when you get home at night is taking a bath towel, fold it in half again and roll it, and you lay it on the floor. And you position that towel vertical between your shoulder blades. So you're gonna lay on the floor with that towel between your shoulder blades, and you're gonna open up the chest, and you're gonna bring those erector muscles of the mid back that go up into the neck. You're gonna bring them back to length. Because, over the course of a day and a week and months, those muscles are just being chronically tightened. And neurologically, your nervous system says that's new normal. And so we want to show the muscles their length. And so you can reset the length on a regular basis. And this is how you get longevity. The more length we get in those muscles, it keeps the spacing between the vertebra and the disc spacing. So we have healthy discs, and you will have a long, successful career as you keep those discs well hydrated.
Wonderful.
Yeah, for sure.
Thank you. Appreciate it.
Great job, guys, on this. So my first question to Dr. Ben, what was that all about for you?
So I'm sorry, can you ask that question one more time?
So what was that for you? Give us some context, why that question?
Yeah, so that's a question that I have been thinking about and pondering for a while now, because as a surgeon, longevity is important for me. This is not something that I plan on doing only for the next year, but for the next 20 years. And I certainly don't want to. I've seen colleagues who have had to undergo different surgeries and who have had to limit their practice because of mobility issues and because of pain. And it's a real concern for me, and my ability to stay pain-free and to stay mobile is my ability to treat patients and to help other people. So it's a big deal for me to be able to do that.
Yeah, and that's a really good perspective for anybody out there, actually for everyone, who has any kind of strenuous, job, physical job, and to tell you that, surgery is demanding is actually an understatement. On so many levels, it's super intense, and so therefore really demanding. Thank you for that, Dr. Ben.
Thank
Dr.
you.
Matt, context, give us some context, and what was that for you?
Well, thank you. Yeah, what you described, Dr. Ben, it is not unique, right? I've worked with a lot of professionals like yourself. My father was a dentist growing up, and he's 83 and still very, very active. But he has now, just because of his positioning, he was a general dentist, has hunching in his upper back. And so I look at that through the lens of reverse engineering, like how could we prevent that? And he had a beautiful career, practiced for 40 years, and it was fulfilling to him. But my goal is to help professionals like yourself to find fulfillment in their work, because what we do is so gratifying. It's so gratifying to help somebody who has a condition that we're familiar with, and we have a solution for them. And to be able to do that for, whether it's a long time or a short period of time, but to do that successfully without feeling the negative physiological toll on our own bodies, and not just bodies, but bodies, minds, and spirits, right? To have that to stay in alignment, I have no doubt in my mind that someone like you can work as long as you choose, as long as it's fruitful for you. So that's what's present for me, is just pouring into you and pouring into people like yourself to help you find, that continued gratification in your work, and avoiding some of the physical taxes that people do pay.
That's a beautiful
Absolutely.
mission, Dr. Matt, and more specifically, pain is a distraction. And not only is it a distraction, it's also a major impediment for your health, because cortisol is released, it's a stress issue, and really detracts from your ability to be that best version of yourself. Because there's only so much pain that you can ultimately tolerate. But you said a lot of very interesting things that everyone can relate to, or it should be relatable to everyone. Simply the water intake, the fact that it's beef jerky versus a filet mignon. I mean, what a great metaphor! And I never thought of it that way. And now I'm thinking, oh, I really need to do a better job, with my water intake. And I have the same problem, as Dr. Ben has, including the one I just simply forget. But having that criterion of, first 20 ounces, within the first 20 minutes, and the first half by 10:30. I mean, that's doable. I mean, that's a plan that can be easily implemented by everyone. But an interesting thing that I do want to share, and Dr. Ben, this is very relevant for you, and I learned this from other chiropractors, is that in reality we all need to be adjusted once a week, and professionally, because that really determines, as Dr. Ormond is saying, it's your longevity. And one of the issues with our longevity, and people may not even realize this, is that we are a very complex network of communication, and not only through our nerves, but also through all of our tissues. And so when the structure of our back, or the spine, is out of alignment, or any other part is out of alignment, it's going to affect that. Now, people may think, well, how's that even possible? Well, the truth is that we're much more than hormones and nerve impulses. Our cells are able to communicate at the speed of light. It's all about energy transfers. And so anything that inhibits the natural, connectivity that we're born with is certainly going to affect that. For example, it will affect your heart, and by corrective measures. And it's given me a whole new respect for chiropractors who are helping us adjust our bodies structurally. We all need a chiropractor in our pocket at any time. So that's what I wanted to share. Any other thoughts that you both want to share in any context as to what we just discussed?
Yeah, I think that what you were saying earlier, Matt and Bart, I think that it really, our livelihood is not only our ability to provide for the people who we work with and for, but our ability to provide for our families as well. And so I think that there are a lot of people who go to work, and maybe just the strain and the stress of of the fact that they are providing for somebody can add to that tension. And it really is helpful to be able to have a few of these strategies to be able to go home and say, I'm doing this in order to be the best provider that I can be, and to increase my longevity. And I think that those tactics, yeah, I agree, very practical. Get a little bit more hydration in earlier on in the day. That's something that I can do. That's something that I should be able to implement pretty easy. And then when I come home and I have a couple of strategies for decompressing and relaxing before I go to sleep, that's definitely something that I can implement at home as well, and will help me to extend my work.
Awesome. Brilliant.
I love that
Matt,
one.
what else
And
have you got?
thank you, Dr. Bart. And I love your framework for chiropractic. And what you said is entirely true. And I think more and more there's traction around this. People are gaining understanding of, oh, this is how I use a chiropractor. I believe any one of us need a body worker, especially professionals need a body worker that they can trust, they can work with, they can share. You know, what happens oftentimes is we play defensive medicine. And so, we get behind a problem, like let's say we have numbness and tingling into a hand, and you're a surgeon. Now we're behind a problem. And while that's there's solutions there and we can resolve that, if we can play proactive, it is a whole different ballgame. It's a whole different ballgame. And then we're at this level. We talked about stress just a little bit, but I think the idea of recovery, it falls within this category of resetting the body on a regular basis, resetting that nervous system. And, I think children, Dr. Ben, you have a lot of children. I have 6 kids. I've studied through the lens of science, and as a scientist, I've looked at them and see they can have stressful days. They can have difficult things happening, and they know how to play, and they sleep well. And the next morning they wake up ready to go again. And what they're in pursuit of is they're in pursuit of joy. They are searching for it. And so I've come to it. I've niched myself into this space. I didn't know I'd be here, but I am a practitioner who really focuses on stress. And I look at the body as a glorified, I'm an electrician. I look at it as an electrical circuit system. When that body's in a state of fight or flight, the electricity goes into a state of chaos. And so blood is shunting wherever electricity is going. And so bringing that body to reset that nervous system to a state where it's balanced, which our children show us how to do often. You mentioned a nighttime routine. I think there's value in these things. It doesn't really matter what that routine even is, but the fact that we do one and we've implemented it, this is how we buy years. And it's longevity with the context of lifespan. So not just how long we live, but how well we live within that time. And these are the strategies. And there are strategies, there are principles that every single one of us can use and benefit, regardless where you're at on the spectrum of health.
Well, beautifully said, Matt. And the truth is that many years ago, I thought chiropractor was a dying breed. And at one point, it seemed it was going to be that, until many of you guys decided, you know what, there's much more to chiropractic than chiropractic itself. And you began incorporating all sorts of wellness modalities that conventional medicine wasn't offering. And quite honestly, those are spectacular and pretty amazing in every respect in obtaining, optimum health. And so, I compliment you for that. Stress is a major issue in our lives today. And so critically important for us to also address in a more unified or comprehensive way. And one thing I really do want to share, you mentioned something that, we are reactionary, we are symptom focused, and we're behind the 8 ball basically at that point. The truth again is, as the work that I do and the message that I'm sending out there, is that we actually do need to put our strategy or approach upside down. Not for the surgeons necessarily themselves, but as the unified whole of wellness. And one of the tenements of optimum health is structural. And as physicians, myself, surgeons, or anybody out there, we always have to address structural in any part of a plan for optimum health. And then the other part, which you did refer to, and I forgot about the diaphragm not working that well, but oxygen. So 2 of the 5 things that we need to be looking at, and you'll have to listen to the next podcast to learn about the other 3. And oxygen is another big one. And most people, most practices don't even consider that an issue, but underlying many chronic diseases is lack of oxygen consumption. And so very, very important things. I'd like to wrap it up there. But before we do that, Dr. Matt, how do people get a hold of you? And final words from you, and then from Dr. Ben, same thing, and then we'll wrap it up. So Matt, you're first.
Thank you. What a beautiful opportunity. Thank you for this. So I'm on the social media platforms. Facebook is Matthew Ormond. Instagram is Kinesiology Doc, and I can be reached and DM'd through those mediums at this point. And final, Dr. Bart, thank you for putting this platform together for practitioners like myself and like Dr. Ben to speak into our craft. I truly believe, I'm on a mission, and I'm grateful that I'm not alone in this mission, but my mission is to be a part of the solution to help relieve human suffering. And it's what a privilege to share this message with your audience.
Right.
And what a great mission as well. Dr. Ben.
Thank you. Yes. So Benjamin Zuniga, DDS, my website is copperbasinoms.com. And you can find our phone number on there. My email address for those who are looking to find us or to communicate through that is benzunigadds@gmail.com, at copperbasinoms.com. So you can reach me there, and it really has been an opportunity and a privilege for me to be here with you guys as well. I enjoy sharing these thought-provoking discussions. I think that we become better as we really reach out to other professionals and increase our network and knowledge. And not only that, but being able to also provide education for the people around us, for our patients, is really very important and useful as well.
And for all those listeners, I mean, seriously, I know surgeons, and here's a cool dude, super cool surgeon. Definitely the best demeanor I've seen in a long time with surgeons. Matt, of course, he's so awesome just the way that he is. But as a surgeon, that says a lot. And I know that you're incredible at what you do in helping people reconstruct their lives, by reconstructing their faces and their mouths, when it's necessary, because those are really important parts of our lives. I want to thank you both. The podcast is a important platform where we can actually have the conversations that we normally don't have. Oftentimes it's lectures and it's products, and you get lost in all the information. This podcast is really more relatable, also engaging, and it's authentic. I mean, these are real problems that we display, and sometimes people get a little nervous about that. But the truth is that when you witness yourself in these problems with my guests, you can find out that, yes, you're not alone. Yes, there is a solution. And yes, other people are working on it to better their lives, and so can you. So I want to thank you for listening. And the best thing you can do for yourself, if you need to, is reach out to Dr. Matt, Dr. Ben, if you have any of those issues, and certainly take some action, because you deserve it. By being proactive, doing things in advance, you're going to avoid a lot of pain and suffering in the future, and have a better quality of life, longevity, and opportunity to do whatever it is that you want to do. Thank you for listening. My name is Dr. Bart Rademaker. This is the Doctor's Guide Podcast, raw and unfiltered, and we will be back. Thank you both.
Thank you.